1,500 people joining today, either directly on this Zoom or through the YouTube live streaming. This topic is so exciting because it's so close to my heart, because it represents our collective efforts over the last 3 years to deal with what we call the infodemic, too much information that makes it hard for people to find the right information. But it's important because we showcase to you the practice we have learned over the last 3 years, put it into the document to help others who are interested in this topic and would like to do the same kind of infodemic insights generation and recommendations to respond to such event. I'm so happy that we have worked together with our friends from UNICEF to develop this, because there's so much experience from the field, what has been done in the last 3 years. Today, we have a very fantastic lineup of speakers that will talk about their experience in this area. And I will present at each session the speakers to you, so it's fresh in your mind when they talk to you. But without further ado, I would like to introduce the first 2 opening speakers who will set forth the scene. These are very senior people in the agency, so we're very glad that they have made their time to come to talk to us and make that opening introduction. First, we will have Dr. Sylvie Briand, who is the Director of Epidemic and Pandemic Preparedness and Prevention in the World Health Organization Health Emergencies Program. And we have Dr. Ephraim Lemango, who is the Associate Director of Immunization at UNICEF. So first, I would like to ask Sylvie, will you take the floor, please?
Yes, thank you very much, Tim, and good morning, good afternoon, and good evening to everyone online. And thanks to the team for organizing this very important meeting and the launch of this important guidance as well. And as you said, Tim, what we learned during the COVID-19 pandemic is really that infodemic cannot be eliminated. It can just be managed. And how do we manage infodemic? The first step is really listening to communities, to population, to understand their concern and their question. But listening, like the infodemic, is very complicated nowadays, because in the current information ecosystem we are in, if you listen to all the concerns and things that people are saying online and offline, sometimes you get overwhelmed as well with all this information. And so I think this is why this manual is so important, because it can help analyze data from social media together with community feedback mechanism and health information systems to better understand how the information ecosystem is affecting the attitudes, perceptions, and behaviors in communities. And this manual, for the first time, provides a series of steps on how to develop infodemic insights that captures this question and concern and characterize circulating narratives and health misinformation. It is a state-of-the-art reference from the 2 leading agencies for how to generate infodemic insight and recommendation for action. And I hope that the global infodemic manager community, spanning 142 countries, will work with the ministries of health and other colleagues to further develop this field and help us to improve our collective tools so that we can get better prepared for the next pandemic and also ready to answer any new event, be it an epidemic, a small outbreak, or any other health crisis that we can face in the near future. So I would like to thank our UNICEF colleagues and our partners from ministries of health, academia, civil society, and technical cooperation partners who have all contributed to this manual and help us to advance the fields of infodemic management by providing guidance and tools to analyze infodemic and provide insights. So thank you very much. Over to you, Tim.
Thank you, Sylvie. Thank you very much. And Akram, can I right away turn to you for your opening remarks?
Thank you very much, Tim, and thank you so much, Sylvie, for providing us these opening remarks. And I'll just follow that suit. Colleagues, in UNICEF, one of the key things that we work on is immunization and vaccines, and this is vaccines for children, adolescents, and adults. And one of the things that we have learned over time is the importance of building vaccine confidence, a very important aspect of delivering vaccines and also other essential health services. Some of you may have read our recent report, which is the State of the World Children report, and that first time to focus on vaccination. And in that report, we speak about three important things. One is the need to really catch up on children that we have missed during the pandemic due to disruptions caused by the pandemic and pre-existing conditions, and to really find ways of addressing some of the inequities that prevails in our health systems and affects those most marginalized communities. And the third and most important is we talk about vaccine confidence. In our research, we have seen there is a growing lack of interest or some of waning of interest and understanding about the importance of vaccines from countries to countries. And such vaccine hesitancy and vaccine confidence-related challenge do not know border. They happen in high-income countries. They also happen in middle-income countries and low-income countries as well. We have been continuously monitoring this issue, and we have realized that it changes over time. It's quite volatile, and it's very important that we as health community have the capacity to be able to monitor it and be able to respond. And that's where it comes with the point that communities have several questions about vaccines and also about any kinds of health services and health conditions. And especially in states where we have significant emergencies and outbreaks of disease happening, and of course pandemics, as the one we have seen in COVID-19, communities do need information that is suitable to the questions they have in a way that is convenient, provided in a way that is convenient to them. And that's where there is a great value in discussing this important manual that we are launching today. UNICEF is quite delighted to have partnered with WHO to develop this Infodemic Insights report manual, which is going to be quite instrumental in encouraging our managers to be able to be systematic in responding to such kinds of abundance of information of all kinds, both positive, negative, and different kinds of information. I myself have had a chance to go through the manual, and I can assure you that it is a systematic manual that provides side of critical steps that each person can take to ask the right questions, to identify the right problems, and be able to use a systematic approach to analyze the types of questions that communities are facing, both through offline and online media, and also really conceptualize our approach to respond to that. In the power of vaccines, the biggest bottleneck that we will likely have in the future is abilities of communities to take vaccines as they are. And it is very important there is a greater confidence in these vaccines. And of course, other tools that helps us to prevent, respond, and be able to address epidemics, pandemics, and multi-country outbreaks. I would like to use this opportunity to thank our colleagues in WHO for this excellent partnership that we have had in developing this, and but also our joint engagement in leading the Infodemic managers training and skilling efforts over the past few years period. And also use this opportunity to thank our UNICEF country office, regional office colleagues and partners and ministries of health, academia and civil society and technical cooperation partners for contributing immensely to the realization of this Infodemic Insights manual. That will be quite instrumental in pushing our work going forward. I've heard there is more than 1,500 people listening through YouTube and also attending through directly on the webinar. And I wish everyone a productive deliberation over the next hour. Thank you so much.
Thank you, Ephraim, and thank you, Sylvie, for your inspiring words to our audience and setting the scene for this webinar. If I may, a small housekeeping announcement. If you have questions and would like to raise topics, please use the Slido for this. You can see it right now. Use your QR scan to scan directly, or go to slido.com and put in the hashtag Infodemic. And you can communicate directly with the moderators, who will pass on your question to the audience. We will have, after the next introduction session, 2 sessions. One will be introducing to you the manual, and then we will be listening directly from the field, from colleagues that are really working in the weeds of infodemic management and sharing with you their experience and how they use infodemic insights into their daily work. But before we go and dive into, I would like to hand over to my colleague, Sandra Makiri from WHO, who will be managing the next 5 minutes to get to know you a little bit, the ones that have joined today this webinar. Over to Sandra.
All right, thank you very much, Tim. Welcome, everyone. Welcome, everyone. I think we have sent in the chat that please do log into Slido. We just want to get to know the people that are around today. And already I can see people are typing in, because our first question that was showing was, what country are you tuning in from? And we see there's Yemen, India, Argentina, Sweden, Egypt. We have people from all corners of the world. And thank you so much for making time to join. Whether in the morning, afternoon, or evening, this is great to see people that have logged in. So continue to log into Slido. This is the platform that we're going to be using to communicate, even to ask questions. So yeah, wow, this is great. Switzerland, Germany, thank you. We want to go to the next question. We want to know, if scientists had just discovered a new species and they decided to name it after you, what species would it be? Very interesting. We have 5 options and we see, wow, okay, this is great. A lot of you want to be a turquoise tropical flying fish that can grow to the size of a hydroplane. Interesting. This is great. Okay, so this is just to pick your brains on, see your imagination and how it goes. All right, so we could move on to the next question. What is your experience with infodemic management? Here we have 5 options. Have you incorporated some infodemic management in your day-to-day work? Some are interested in the topic but are still newbies. Welcome. And yes, some have incorporated infodemic management in their daily work. Okay, this is great. So we have some newbies. Welcome to the club. We're going to move on to the next question. Have you ever done integrated analysis of online and offline data sources for public health? This is a yes or no question. Yay, we have a lot of people that have actually been part of integrated analysis of online and offline data sources. This is great to see. And we also have some people that are new, and we hope that this session will be helpful in understanding what this is all about. And the manual will also be helpful. And then lastly, we want to hear what you think is the biggest upcoming challenge in infodemic management post-COVID. Here you're free to put in any responses. This is a free will. We want to see what the challenges you think are. Someone's talking about trust. Indeed, trust is a big issue that we need to be discussing. Unpreparedness, information overload, learning from our mistakes, transparency and accountability, a lot of responses coming in, verification, multiple issue, cross-cutting problem. Yes, well, continue to send in your responses. We really want to know what challenges you think have come with infodemic management post-COVID. Lack of synthesis of data. So hopefully this manual will be very helpful in addressing some of these challenges that we've listed in Slido. So continue to be logged on. This is the platform that we're going to be using for our question and answer session. And yeah, thank you very much. Over to you, Tim.
Thank you, Sandra, for giving us a brief glimpse on the kind of audience we are having today. So happy to see some experienced infodemic managers there, but also people who show very keen interest in this kind of work, and hopefully they take something with them from this call. And please continue, let us know your questions to the Slido so we can moderate this and then post them back to our speakers today. So without further ado, we would like to start with the next session, which is really the introduction to this manual, to explain why we need this manual and how integrated analysis, what that actually means, what are the definitions of infodemic and social listening. And here I'm very happy to introduce to you Surani Abayesekara from UNICEF, a very esteemed colleague who is one of the forethinkers in this area. And when I think we asked, hey, do you want to partner with this? And I think there was only 5 seconds when the email came back to us, yes. So Surani, thanks so much, for being our partners in crime, and I hand over to you.
Thanks, Tim. Colleagues, it's been a wonderful journey. And I think we've arrived at a very exciting day today where we are launching this manual. And I mean, it's just not only the launch of the manual that we are so excited about, but the fact that it's going beyond the launch. We will later talk about how we are taking it into country and regional level capacity building within the organizations and also beyond the 2 organizations as well. So I think we are very, very excited to see how this is shaping up and also trying to see the fruits of the labor of several years of relationship with WHO in this area of work. I don't think I need to go through the definitions in detail because there were quite a few of you who mentioned that infodemics is your daily bread and butter. But just for the sake of being on the same page, what we dealt with within the last couple of years is not new. We've been dealing with infodemics, I think, for a very, very long time. But I think the discipline of infodemic management is something that came to a head within the last couple of years with COVID and, how we saw this overabundance of information, which sometimes is accurate information, but sometimes, or in some cases, which is not very accurate. And we also saw the influence of, the platforms that exist in our world today, whether it is online platforms, offline platforms, the community level discussions that take place, and how all these have an acute impact on, when there is a health event, whether it is an epidemic or whether it's a outbreak of disease. And we also see how the impact of these situations and this environment has on people itself. People have, and we heard from it from Sylvie, where they also spoke about how it impacts the questions that people have, the concerns, worries that people have about various things related to this outbreak or the epidemic. In this same environment, we also see a huge amount of misinformation, disinformation that is also circulating. So we're looking at this very volatile environment, which has a huge impact on trust in health services, trust in say, for example, the vaccine that is being promoted or the health intervention that we're talking about. So this volatile environment is what we're dealing with. And what we are trying to see is how do we help people working in this area to come up with this thing called the insights reports, combine all the listening that is happening, whether it is listening on social media platforms, whether it is listening at the community level, whether it is data sources that are, epidemiological related or health system related, and also our social and behavioral data. How do we take all this and then analyze it in a systematic way and an integrated way so that we can then come up with the insights reports that will help our communication interventions in the future. So that's basically what we are looking at. Infodemics, as I said in the previous few minutes, it's here to stay. It's gonna stay, and it's going to be the bane of our existence as we move forward in this world. So we saw how a little bit of misinformation can then spiral into huge issues. We saw that happening during COVID, when vaccine introduction was taking place. We saw that happening when monkeypox was right. So it's something that has been, we saw it happening when AIDS came into the world, so it's been happening, and it's going to continue to happen, and it's going to be much worse as it goes on, because of the fact that we have a huge proliferation of media platforms that people have access to. So if we are not out there with the right information at the right time, which is credible, people are going to look for information in places that are not so credible. So we need to be ahead of the game. We need to be there in front with the right information so that people can get what they want. And when we look at, what is the purpose of these insights reports? What do we do with them? Is it something that we do a nice shiny report and then it's beautiful and then it goes nowhere? Or how do we channel the insights reports and the insights that we're looking at into the communication response that we take forward? How do we then build our response from the ground up? So when we start, as the previous speaker spoke about the importance of listening, when we look at that listening and what we hear, the narratives that are taking place, how do we then channel that into our communication response and build our response around that? So it can help programs understand the information environment, how it affects people's questions and concerns and attitudes and perceptions. So by doing this listening, by gathering this data, we are able to be better informed in our response. Whether it is an emergency or an outbreak, that's going to help us as we move forward. When we've seen insights reports being generated by so many organizations, WHO, UNICEF, different ministries of health, CSOs have been doing it for a while now. And we've been also seeing that these insights reports cover different issues, whether it's COVID, monkeypox, or cholera, or measles, or whether it is routine immunization. So how do we take what we are doing now into the routine work that we are working is very, very key. And we've seen it being applied across the board as well, beyond health, whether it's mental child protection issues or nutrition. And we've seen how the impact of doing proper analysis, proper insights generation, and then taking a look at it has helped in our response as we move forward. So in terms of how we develop these insights manual, I mean, it's been a long collaboration, long nights, taking a look at drafts and working on the content. So the two organizations, UNICEF and WHO, have collaborated for several years on social listening and infodemic management training. I know quite a number of you participated in the infodemic managers trainings that we ran for the last several years. I think we've had 3, and there were huge cohorts of people that were trained during these sessions. Very exciting trainings that took place over the years. So we have been collaborating for a while now. And when the pandemic started evolving, more and more countries began conducting social listening and infodemic management work. We've looked at, when we spoke to our country officers, whether it is WHO or UNICEF, we've seen large numbers of countries are actually tracking conversations that take place. But what we are now trying to bring in is that systematic way of looking at that information and tracking it and building the narrative and then taking it forward after that. However, some of the biggest gaps colleagues reported from the field is the ability to combine this online and offline data sources. So we do have online platforms that do some of the analysis for us. But then how do we bring the listening that takes place at community level, which is a critical component of the work that we do, and then merge that to come up with the narratives that are taking place at the community level. So this was one of the biggest problems that we were having, our country officers were looking at, is this combination of looking at the online platforms and the offline platforms, and then bringing that analysis together. The manual was drafted, or we started doing it in Q4 of 2022, and it had several cycles of iteration, consultations that took place within UNICEF, within WHO, within the wider infodemic managers community. We took it to the SBCC conference in Marrakesh in December. We spoke about it and we looked at it and fleshed it out. So there has been several sessions or several layers of iterations of this document. And today we are presenting to you the fruits of our labor in terms of the final product as we go through today's webinar and then the future work that we are going to be doing together. Tim, back to you.
Thank you, Sarani. Thank you so much. And seamlessly, we will go more into detail of the reports. I'm happy to introduce to you Tina Punat, who is the team lead for infodemic management here in WHO. So she is the second half of the brain in putting this report together. So Tina, over to you, please.
Thank you, Tim. Thank you, Sarani, and hi, everyone. So yes, what you see here on the screen is basically a bit of the structure of the manual and all of some of the resources that are a part of it. It is describing a workflow of how this integrated analysis of the data sources that Sarani was mentioning can be conducted, all the way from planning your work and a question of concern to all the way conducting the data collection, analyzing the data, performing a risk assessment, formulating recommendations, and then also disseminating the insights and tracking the action taken. So these are the 6 steps that are a part of the manual. But it is accompanied with a variety of additional practical tools. So because it is intended for an analyst that is starting out in this journey of analysis, it is accompanied by a variety of editable templates that an analyst can use in each of the steps that helps organize the work and the workflows. There's an accompanying workbook that is easily downloadable and or printable for reference. There's also a teaching simulation that is available for those of you that may be interested in teaching this. The simulation is using components and elements of interactivity that we had actually perfected through the Global Infodemic Manager trainings that Sarani mentioned. And those of you who are interested in e-learning materials, there's actually an accompanying materials related to that as well. And what's probably also most important for those of you that work in different health programs, there's an annex with different types of outbreak response and immunization related resources. And if we go to the next slide, we can show some. So there's 13 annexes that allow you to refer to and deep dive a little bit into most commonly asked questions and requested support that we had received. In addition to receiving questions from our country offices, from people working in the field, how to do this work. There's also things related to advice that they've been asking related to, well, how does one run a meeting for with the cross-disciplinary team for this data analysis? How do you evaluate the data source? What are the aspects of equity language, equity sensitive language that one needs to consider? What may be some advanced techniques of analyzing social listening data through taxonomies for categorization. So these are all additional resources that you can pick and choose as needed, including, for example, considerations for people working in different mature operational environments, where resources and data sources may be of different composition. So if we go to the next slide, I would like to also show you some resources that are available for teaching and using this manual. So the manual is accompanied by several e-learning courses. You see here on the left 2 that are currently available, but there's also other related courses, both on the WHO Open WHO platform, in the UNICEF Agora platform, and other e-learning platforms of our partnerships. But what is also very interesting is this teaching simulation that I mentioned before, that basically you're free to use for an interactive 4 to 6 hour teaching simulation on how to do this integrated analysis. If you're interested, here's the contact for this simulation. There's also 5 annexes for people that work in different health programs or for a particular public health focus, on how to do the integrated analysis, for example, when you're trying to reach zero-dose children, or for example, for polio programs, or immunization programs focusing specifically on seasonal influenza. The 4th annex is related to vaccine safety events analysis, and the 5th one on performing integrated analysis in preparation and during mass gathering events. So this can be very practical set of resources that you can produce as needed. So let's go to the last slide. In a sense, actually, I invite you to download the manual, look at the accompanying library, online library of digital material. The way that we see it is that the manual is like a cookie baking recipe. It provides you the 6 steps are the elements of the process. It provides you on these ingredients and the different process of how you can assemble these ingredients, but you can then customize these add-ins and you can adapt them to your working environment, which means that we encourage you to test it, adapt it, definitely tell us what your experience is, and let's get baking together, so to say. We would be very interested to apply this now in the next iteration of all of our collaborations. We feel that this is something that can really be helpful now for both the emergency preparedness and response, outbreaks, immunization topics. And why this manual is really important is because the process that we've captured through all of these consultations really focuses on speed. So rapid analysis and rapid understanding of how narratives are shifting is really key, and being able to do this systematically through the process that is described, where we have a common language and a common understanding of the elements, is really helpful. So I would hand over back to Tim and to the next series of speakers. Thank you.
Thank you, Tina, and thank you, Sarani, for introducing the manual to the audience. And I think it's a lot to take in, and I think the best is just to open the manual yourself and scroll through. It's also very visually attractive. So we had really a great human-centered design colleagues who really, took a step of how we present, this complex field in a way that is also visually perceiving to you. So next we have a set of two speakers who come from the field directly, who apply this in their day-to-day work and who can share with us their experience and their understanding of infodemic insights generation and how to use that pragmatically in their line of work. So first, I would like to invite Dr. Yaya Dizu, who is the head of RCC working group and the leader for infodemic management at the Nigeria Centers for Disease Control. So can I ask colleagues please to screen Dr. Dizu's slides, and then I hand over to you, Yaya. Over. Yaya, in case you're speaking, we're not hearing you, so maybe you're still on mute. I guess we're experiencing some technical difficulties. This happens, you know, sometimes. We apologize for this. So maybe while we're maybe fixing this technical problem, maybe I introduce the second speaker, and maybe Omar, he could start. So our second speaker is Dr. Omar Mekasi, who is the global data quality lead for Internews. And you know, if you follow Internews, they've been doing some fantastic work in the field of infodemic management and access to information and data. So happy that Internews and through Omar is joining us today. So Omar, can I hand over to you?
Yes, thank you, Tim, for that. Let me start by sharing my screen. Okay. Cool. So today, basically, I'm going to be talking about like how we actually improved our service and programming through our social media listening approaches, and more talking about the rooted in trust experience on what we did. And as Tim said, that we actually worked a lot on social media listening, and we worked actually in 13 country teams during the COVID crisis, I would have to say. And there we actually pulled data from different platforms, from different channels, from private groups, and ultimately to capture qualitative data. You can see here qualitative data is quite bolded for a reason, and this is somehow in depth of our methodology, at core of our methodology, and basically pulling 13,000 offline rumors and perception and 23,000 online data from these 13 country teams. And what I want to say here that basically the qualitative data, why is it? It's a key factor of actually our social media listening that we did, because basically it informs us on what to produce. So this is the one. It told us whatever to produce, a bulletin, a snippet, a video, a podcast, or something else. And it also told us on how to disseminate such information or such production that we produce, whatever it is, from a mass media, mass email, a newsletter, even a group response, like on a Facebook group, or as a comment, or through the pages themselves, and to whom. So if we would like to target humanitarians, specific communities, and specific marginalized communities, which are quite complex even to reach sometimes through social media listening and engagement online. So what I want to say is mostly out the nature of our data, and was that it was, first of all, it had timely responses. By collecting these qualitative data, we had timely responses. We did not have academic data, so we were responding to communities in a non-academic way, in a quite simple, intuitive way that responds to community needs. Third one, it was very, very targeted. And the fourth one was more community and contextual driven responses. So that is like at the core of building trust with these communities. And what I want to say more about the benefits of social media listening, not only through the health pandemic, but also beyond that. The first point, that it did support us in situational awareness, basically providing us real-time insight on emergency, what's happening here, what's happening there. Second one is on early warning systems. So basically by extracting data from social media, we did capture a lot of signals, a lot of data that basically told us that, yeah, potentially something might happen here or there. Third one is that it had really targeted responses by when we actually analyzed the social media conversation and the sentiment. From these sentiment, we actually knew what and how to target through our engagement, whatever it's on social media, whatever, even on offline mode, because as we said that we captured from both worlds and we tried to merge them together even in a way. So we had both streams of data coming in. And the fourth one is about like public perception and feedback, and basically understanding more misinformation that is happening on more broader level, and understanding more the public sentiment around that. And the last one is about more the collaborative network and building that trust. So all of these points that we talked about, this basically shaped our strategies and the risk communication, and even the community engagement that we had during the Rooted in Trust project. And the last slide that I have is about the lesson learned. These are very, very generic, but I keep repeating them always. The first one is about advocating strategically, about the use of social media listening methods, which is very, very important, and we need to do it more. And so this is the one. The second thing is about building skillful team, because I would have to say that doing social media listening is not always super intuitive, super easy, and especially with the evolution of the social media, evolution of technology. I saw one of the questions was about like threads. Yeah, threads is something very new. Maybe we need to have a look at it and how do we approach it. And the third one is collaborating with partner on multiple levels, but at essence, it builds trust. It builds trust with the partners, local communities, and basically with everyone. And yeah, I would like to invite you also to scan the code, and if you would like to visit our website. Thank you.
Thank you, Omar. You're spot on in your 5 minutes. So thank you for really, being very concise, but giving, great insights into the work that Internews is doing in the area of social listening and infodemic insights. Let's try again with our friend Yaya. I hope we have been able to help with resolving the technical issues. So Yaya, do you hear us?
Good afternoon. I can hear you.
Excellent. Then I'm handing over to you while the team is putting up your slides. They are on. So over to you, Yaya.
All right. Okay. Thank you. Good afternoon, everyone. I really commend the organizer. On behalf of Nigeria Center for Disease Control, we are grateful for this opportunity to share our experience of what we do in community infodemic management in Nigeria. And my slide, I will be sharing experience of how we use insights from this social listening data. And this dates back to before COVID-19 pandemic, when we're relying on event-based surveillance system, where we use Dataflow. Dataflow was a homegrown platform to survey social media to scan for information about priority diseases, and so that communication, information, perception, misperception, and so on. Please, next slide. So, can you move to the next slide? Okay. Hello?
Yes, we have moved to the next slide, Yaya.
Okay. So you can see what we do with regards to data collection. We use multiple sources. The starting point was then event-based surveillance system, and then also the call center where we tried calls, and then they are all logged, documented, so we analyze them to get insight. Then later, we started the digital
Yeah, I think we have lost you for a second. Dear friends, this is the reality if you connect from all over the world with areas with low bandwidth. So it's very unfortunate.
Okay.
Yeah, we have you back.
Okay, so sorry, the network is fluctuating, technical issues here. So we also started community opinion polling and then perception survey during the COVID-19 pandemic to quickly understand what people are thinking, the knowledge gap, perception, the mood, and then even to gauge level of trust, confidence in government, what government is doing. And later, we introduced community polling as well as using data from focus group discussion, as well as feedback from the community, community engagement meeting. All these, we have MIA data analysts who put all this together to get insights. First thing we were using the insight for them was for informed decision making. Example of that was adjustment of COVID-19 protocol implementation. So sorry about that. And the preventive and social measures were all based on the information we're getting from the public as well as community, and then juxtaposed with the surveillance data and epidemiology. Then later, we began to adjust our messaging as situation evolves, as new information comes from the people and from science, and also adapted our strategy. We started with crisis communication in the beginning. Then over time, we moved to precautionary advocacy. So we kept changing the theories, and from health belief models, we expanded parallel processing model, then later addition theory, when vaccination came, 3C models, and so on. So it is insight we are getting that we use to adapt our strategy. Then we also develop systems and tools and to facilitate infodemic management operations in country. And when initially we started from national using online tools, then we have to build capacity in subnational at the subnational level, interest states out of the 36 states in country, and the community, the states, the local government, they're able to develop their own insights and then they get data from community. And then so they have the place where they log this. So on weekly basis, there was meeting between the state and the national to understand what is happening in epidemic management space. And then also training programs were also developed based on insight. One of them is the development of social media strategy that we now use for improving capacity of people for public health communication. And we currently launch a media program, the media fellowship program. We call it Media EIA. It's as a result of the information we're getting from polling and then the social listening data concerning the media. Media is trusted, but sometimes there are also channels of misinformation. So we felt that we need to build their capacity. We've been doing hardware capacity building. We felt we need to do intensive training that will build their foundation as well as social behavior change communication. So, so how we do our work is through collaboration with partners, various partners, government MDAs, as well as international partners of WHO, UNICEF, Breakthrough Action Nigeria, Africa Check, and so on and so forth. And then based on the strengths that each person has that they bring to the table. And then we also leverage we also, can you go back to the last slide, please? The last slide, the previous slide.
Yeah, you're on mute. You have put yourself on mute. Yeah, you have put yourself on mute.
So we have already built a dashboard for community polling, and you can see that in there. So I want to say thank you for everybody, to everybody for listening to me, and I wish if there are questions, and I'll be able to answer them during the question and answer sessions. Thank you.
Thank you so much, Yaya, and I love this slide. Really putting really this framework together, how you strategically and operationally think through that. This is absolutely helpful to communicate, with your teams, and also for us, to be inspired from your vision and how you integrate really social listening and using this social data for triangulation and moving forward your program. So congratulations on this, and thank you for sharing your country experience here with us. Also, thank you, Omar, for your presentation. We are running a bit out of time. We have collected a couple of questions through the Slido. Maybe we can walk through 2 questions. So hopefully, that we can do this in the next 5 minutes before we need to come to a closing. So the first question, maybe this is something for you, Omar. So this comes from a country and asking, how do we utilize data from social listening activities gathered from the community level to use in a practical application or sense, such as converting vaccine hesitancy to acceptance and creating and getting support for our policies? So any insights, how you turn this into practical advice with an example, I think that would be of interest. Then there's a second question. It's a AI related question. So maybe this could go to Tina. We do acknowledge that AI presents a huge challenge in the fight against the infodemic. What are the possibilities to also use it for advantages in fighting the infodemic and conducting infodemic insights reports and social listening? So maybe let's start with these 2, and Omar, maybe first to you.
Yeah, thank you for that. So I wouldn't have maybe the best scenario, but a couple of suggestions. And one of the suggestions is actually, rather than using the automated way of listening, especially social media listening, as we have two ways. We have the automated way, and we do have the manual way of doing that. And I do emphasize onto doing the manual way of that, into capturing these social media data, engaging with the users builds trust. So this is one. Doing it in a, how do you say it, in an automated way, first of all, it wouldn't give you the rich data that you need in order to respond to that at the beginning. So I would say the root cause and the root problem within that question is that we're not good enough at listening. This is the thing. And us being better listeners is by building better trust with people and communities. And by doing that, one of the ways is doing manual social media listening to private groups, listening to people from specific communities, rather than just putting a tool out there. It might be also an AI tool. It goes out there, it pulls out, it scrapes all the data, it gives me a summary, which is not always that understandable or not always that representative even. And it doesn't represent these specific communities that might have this vaccine hesitancy. So I would say at truth, it's all about improving our listening techniques and methodologies. This is at core. Thank you.
Thank you, Omar. And over to Tina.
Yes, thank you very much. So AI tools basically allow to analyze large amounts of data. What kinds of insights or intelligence you get from an AI supported platform really depends on the data that goes in and the types of analysis that you do. So I agree with Omar. Actually, what's really important is combining AI tools. For example, WHO has over the last couple of years developed a pilot platform specifically for online digital social listening supported by AI. That doesn't mean that that's the only data source and the only method that one needs to use in order to understand questions, concerns, information that are circulating. So other methodologies for, like digital ethnography, etc., that Omar was mentioning is very critical. Maybe just to mention last, whatever method and technology one uses, it's really important to follow ethical principles. We work with people that are expressing themselves in communities or in spaces where they feel where they express their questions, their concerns, and we need to make sure that our activities are following the ethics, and that we all ethical principles, guidance, and that we also take into account possible vulnerabilities or concerns that may be arisen through these activities. This is actually why WHO has convened an ethics panel on social listening and infodemic management. UNICEF is a part of it. Actually, a colleague from Internews is a part of that panel as well. And hopefully by the end of the year, we will have also that type of guidance available that will complement the manual. Back to Tim, since we're running out of time, maybe Surani would want to talk about the next week's webinars. And I would suggest perhaps that Dr. Disu records his answer, Tim, to the question that were coming for him, and we can share it with everyone as a recording. What do you think, Tim?
Excellent idea, Tina. Actually, I would ask the team to work with Dr. Disu, because his presentation, the slides are excellent, but we couldn't hear him so clearly. So maybe if this could be recorded and also kept as a case study in the future, I think it's a wealth and rich of information that that we want to keep. I would ask all the presenters maybe to go on the slide or after this call and help answering the questions that we couldn't reflect today live in the stream, but it would be very important if we could give an answer to our participants. So if you can spare 15 minutes to go to the Slido and answer and typing in your answers directly to the questions of our participants, I would be very appreciative if you can spare 15 more minutes to go on the Slido. And without further ado, then over to Surani for the announcement of next week's event.
Thank you, Tim. So colleagues, we're done with today's webinar, and we're looking forward to you joining us again next week. We have two webinars planned. Webinar A is more geared towards a one time zone, and webinar 2B is geared towards another time zone. We'll be on both the webinars. These are two deep dives, basically looking at advanced topics in infodemic insights reporting, and we'll be spending time with you looking at some of the work that has come from the countries, some really interesting country level presentations on the two. Please join us. I know there's quite a number of people who have already registered for the two webinars. I think we have 200 plus for both webinar individually for both of the webinars. So if you can wake up early if you're in this part of the world and join us for the first one, and then again join us for the second one, please do so. It's going to be very exciting. So please scan the QR codes, register for the webinars, and we'll see you on Thursday. Tina, you don't need to add anything?
No, let's just see. I will bring you virtual coffee for the 3 o'clock meeting, Surani, for you, and I look forward to the deep dives. So welcome everyone to the Infodemic Manager community, and thank you for joining us today.
Excellent.
Over to you, Tim.
My special thanks goes to Sandra Makiri and Elizabeth William, both with us in the background to help, getting actually everything running smoothly. So thanks to you, Liz and Sandra. I thank Sylvie, Afram, Tina, Surani, Yaya, and Omar for talking and presenting this today. So thanks everybody. Have a good day. Bye bye.
Thank you.
Bye everyone.